Good evening, everybody. It's Dr. Galvin, and we are going to start the wellness series. I've been talking about this for a while, and I do a lot of videos about COVID because of my experience in the emergency department and kind of firsthand experience with that. But I run Vitality Medical Wellness Institute, which is a precision medicine, high-end sort of concierge medicine practice where we really try to get to the root cause of problems and really make people feel better, perform better, live longer, and all these things. And so to start out the series, we're going to be talking about heart disease because February is Heart Month, and heart disease is still the #1 killer in the US. And actually, it gives us a nice way of transitioning into talking about inflammation and insulin and weight gain and things like that. So I'm going to use this to talk a little bit about heart disease, things you can do to kind of prevent it or predict it and reverse it if possible. And then we're going to start talking about the role that inflammation plays in heart disease and a lot of other diseases, and particularly the role that insulin plays. And that's going to move us on to talking about weight loss, because I think that's one of the big things that people have asked me to talk about. So let's talk a little bit about heart disease. I've been an emergency physician for nearly 25 years, and I don't think it's exaggerating to say that I've taken care of hundreds and hundreds and hundreds of heart attacks. And in that time, I've seen people die of cardiac arrest. We've seen sudden cardiac death. We see people having their first heart attacks. Very often, these people come in and they tell me, "Hey, but I just had a stress test, a month ago, or I just had normal labs. How can I be having this heart attack?" Well, it happens, and we know that it's the #1 cause of death in both men and women in this country. And last year it was 1 in 4 deaths. About 665,000 Americans died of heart disease, be it sudden cardiac death, which is about 300,000, or a heart attack that led to further problems and death eventually. Coronary artery disease is the most common form of heart disease, where you get what we typically thought were blockages in the arteries from cholesterol. And now we've learned that 70% of those heart attacks are actually not caused by blockages at all, but they're caused by plaque that is deposited not in the inside of the wall of the arteries, but actually in the wall of the artery. And they don't cause any blockages at all. But if you combine that with lifestyle factors that raise inflammation, those plaques can get inflamed, and ultimately they can get inflamed so badly they rupture, causing a blood clot. And all of a sudden go from a completely normal blood vessel to a clotted off blood vessel. And if that's in the heart, it's a heart attack. If it's in the brain, it's a stroke. And the important thing to know is that those things are not very predictable by stress tests and lab work and things like that. Family history, risk factors play a role into it. But you can have a plaque in the wall of the artery that's getting inflamed and have a completely normal stress test, and 2 hours later rupture that plaque and have a heart attack and die. And so what we're interested in is trying to predict who has that, and then do something about it. Sudden cardiac arrest or sudden cardiac death is something that we see in the emergency department frequently. It kills over 300,000 people a year, and that's greater than lung cancer, breast cancer, and HIV together. More people die of sudden cardiac death, and very often they're not old. I think that a big percentage of those people are less than 65 years old. And in my career, I've seen people in their late 30s and their 40s and 50s have it happen. And I think most of us probably know of somebody in our lives that, the husband of somebody who was like a fit, athletic person that suddenly dropped dead of a heart attack, unbeknownst to anyone. Those cardiac events usually cause an arrhythmia, either ventricular tachycardia or ventricular fibrillation, that then causes death. Now, if we can get to those people quick enough, usually within the first minute, and put an AED on them, or somebody's got a defibrillator and we can shock them, 90% of those people can be saved. But by the time they get to the emergency department, if you're in cardiac arrest when you roll into the emergency department, your chance of walking out of there alive or intact is far less than 1%, unfortunately, if you come into the hospital being in a prolonged cardiac arrest. 20% of those people that have sudden cardiac death had no risks and they had no symptoms. Their first inkling that they had heart disease was they died. And so, to that end, this idea of plaque getting inflamed, rupturing, causing a clot, causing either a heart attack or death is a big deal. For 2/3 of men and half of women, their heart attack or sudden death is their first symptom that they have any heart disease. They have no idea before that happens. And the important thing to realize is that heart attacks and strokes are preventable. If we can detect it early, there are things we can do to prevent it. Now, you have to talk to your doctor about this. If you happen to be in Charlotte, we actually do a whole cardiac panel to identify disease early. And we do a cardiac CAT scan. We do a chest CT scan to detect whether there's calcium in the arteries. If there's calcium in your coronary arteries, there's very likely plaque. And that's a very early sign. And depending on how much calcium is there, we can sort of risk stratify people. We do a carotid ultrasound to look at the thickness of the carotid vessels to find out if chronic blood pressure problems are going on, which can increase your risk for both heart attack and stroke, and to see if there's any blockages which can lead to stroke. We do an electrocardiogram to see if there's been any damage or any electrical problems with the heart, arrhythmias or things like that. And we also optionally do some very advanced cardiac labs. And what we're able to do with that is predict people who are at risk. And once you know that they've got disease, we can oftentimes detect it a decade before it ever becomes a problem. And if you do the right things with lifestyle, with risk factor modification, with some medications, we oftentimes need to use a statin to reduce inflammation. We can lower C-reactive protein, vitamin K2, lots of other things, keep blood pressure under control. We can do a lot to prevent people from moving on and having a heart attack and stroke, but it needs to be predicted first. So I think it's a good way of transitioning into kind of my philosophy of, instead of treating problems once they've happened, why don't we try to predict those problems beforehand? So this week we're going to just going over cardiac disease because it is Heart Month and everything else. Next week, I'm going to talk about the role that inflammation plays in a lot of body processes, a lot of illnesses, and we're going to talk about insulin, because insulin is a key thing to know about if we want to talk about losing weight and keeping ourselves healthy, because high insulin levels, besides the fact that they eventually cause diabetes and things like that, are pro-inflammatory, and insulin is a fat storage hormone. So if we are constantly running high insulin levels, guess what's going to happen? We are going to get fat. And if we want to lose weight, then we have to be aware of that, and we've got to do the things to lower insulin, and that's a really key thing, and that's why keto diets work well and why carbohydrate restriction works well. And we're going to talk about all that next week. But to this week, look after your health. Think about your heart. If you're at risk, talk to your doctor. If you're local and you want to talk to me about it, please ring us up. We do have a special, and it's on our Facebook page for all those things. And it's a pretty definitive yes or no whether or not you've got heart disease, and also lets us start treatment and mitigation immediately. Everybody stay safe. I will talk to you next week. Have a great day.